Welcome to Tuesday Talks at Cure Studios. I'm Seema Kumar, and today we're joined by Dr. Elizabeth Komen, who has dedicated her medical career to saving the lives of women. She's an award-winning oncologist who is internationally sought-after clinician and physician scientist, specializing in breast cancer at NYU Langone Hospital. Her first book, All in Her Head, The Truth and Lies Early Medicine Taught Us About Women's Bodies and Why It Matters Today, became a USA Today instant bestseller. In her book, Dr. Komen discusses sexism in medicine, the history of women's health, and the increasing cancer rates among young people worldwide. Welcome, Elizabeth.
Thank you so much for having me and for that delightful introduction.
Yeah, and great to actually see you and get a chance to talk to you. And congratulations on your book.
Thank you.
One of the things I was reading the reviews about the book, and it's got a lot of good, glowing reviews and great endorsements, including from Dr. Siddhartha Mukherjee, who's a friend, but also a friend of Cure's. And in his review, he talks about really how All in Her Head is accomplishing a remarkable feat of storytelling. And coming from him, he's a master storyteller. That's high praise. And you're combining medical history and your knowledge of medical history and research you did on it with all the narrative, and the propulsion that a medical thriller has, right? So combining the two, you've written something that is engaging, but also is huge learning for people who read it and, opens your eyes to what we've all been through. So let's talk about the history of medicine and why that is so eye-opening. History of medicine, we learn so much by looking back at history. What inspired you to go that route?
So when I was in college, I majored in the history of science. I had this, I'm a Gemini, a split personality, and I love science, but we know that science is not this absolute truth that we're discovering in a vacuum, but is completely molded by the environment within which it's discovered, who has a seat at the table, who's asking the questions. And we know throughout history that women have not had a seat at the table, that Western medicine has not elevated women's bodies, the study of women's medicine as equivalent or as powerful, or even our intellect. We are more primal than men, so to speak. And history really engages in the experience of illness for women. And I think when we talk about biology versus experience of disease, it's two very different things. There's what you see under the microscope, which is, of course, influenced by what you're looking at. But then there's the individual and the stories they tell themselves about their bodies. And I really wanted to include those narratives throughout history to help inform why today I think women still feel unactualized in ways that I think we could empower their bodies and in their healthcare.
That's very interesting because, if you think about medical textbooks too, and then you see anatomy and physiology, and you learn, the famous drawing by Da Vinci even, you see it's a male body.
Right.
Right? Yeah.
Well, so that's why the cover of the book is a take on the ideal Da Vinci Vitruvian man, and it's a woman in a corset, and it's a little cheeky, sexy twist on that. So thank you for picking up that reference of, we're going to put a twist on the ideal man. But as you know, so much of medical history and discovery was based on the man as the typical and the female as the atypical version of that. You go all the way back into Greek history and whether it was Hippocrates or Galen, the idea that women were this inverted, imperfect version of a man, and carry that all the way through to, it wasn't until 1993 that women were required by the NIH to be included in medical studies. And the assumption was, okay, well, we can study cholesterol drugs on men and then assume that just if we dose them for women, it's the same thing. And whether it's medical imaging or diseases, this sort of idea that you could just translate it, of course, is not true, but what has happened historically.
I mean, that to me seems a little bit kind of, logically, right? Like, we're not speaking logic here, but logically, if you think about it, you would think that, oh my God, women are actually higher actualized human beings because they're able to give birth, right, to men. And you would think that that would actually be the inverse, right? You would have more respect and want to have more curiosity about the body of a woman that's able to do this miracle which we call birth, and yet not so. And you claim that, women have been voiceless throughout history and continue to be voiceless today. How so?
I want to pick up on a word that you said that I thought was very interesting. You used the word curiosity.
Yeah.
And I think being curious is what really helps advance the best of ourselves, whether it's science or conflict. When two people have an argument, right, there's that defensive response or there's
Yes.
that curious response. Why
Yeah.
is it that way? Why do you feel that way? Or whether it's science, why is the body behaving that way, as opposed to assumptions and defensiveness, which is how you see a lot of medical history being carried out.
Yeah.
So I got distracted by the word curious there. And I'm not sure that we are as voiceless today. I think we are gaining we're doing this,
We
right?
are, yes,
and you
we
are
are
certainly
gaining our voice. Yes.
empowered.
Yeah.
But I think it's complicated because you see, certainly in my practice, I treat patients from all walks of life, and some of the most powerful seeming voices that are women's voices may still have feelings about shame about their body, or in a doctor setting experience that power dynamic where it's hard to really advocate for themselves and have the type of voice that they may have in the boardroom or the courtroom, or behind a computer screen, whatever it may be. So it's about how we change that power dynamic, how we get and help women tap into their gut and align with doctors to really feel that they can ask the questions they want to ask.
That's so interesting because, okay, so we feel empowered in many different walks of life, right? We can go to a courtroom, as you said, and fight a case with all the passion and advocate for somebody else. Why is this feeling of shame that we have about our bodies? Where do you think that comes from?
I think there's such a long, long, long legacy of shame. I mean, even if you look at the history of some of the language that we use to describe women's bodies, whether it's the Latin root of pudendum, which actually means shame. You talked about textbooks, and we can touch upon women's sexuality, but the idea that in Grey's Anatomy at some points the clitoris wasn't even in there. So,
Yeah.
and throughout Renaissance, when they started to do anatomical drawings, the idea that there were male
Female
anatomists
organs.
saying that they were discovering it and not discovering it and arguing over who could label it as if women didn't know where it was.
Yeah.
So there's a lot of fascinating history in there.
And, speaking of which, you spoke about some of this last week, actually, at CNN, right? And that was actually a special episode because CNN was reporting that cancer cases in younger women are on the rise by about 79% globally. However, in the older patients, it's dropped, older women, I should say. And you spoke about this with the host, Sarah Seidner.
Yes.
Right? Who actually is recovering after 2 mastectomies and more than 15 rounds of chemotherapy. And after all of that, and she's back to being at the anchor desk, right? So talk to me about, the conversation you had with her. Why are the cases rising? What's happening?
Well, we don't really know, but we certainly know that under the age of 50, whether it's women or men, I mean, colon cancer under the age of 50 is dramatically on the rise for men in particular and women. And there are lots of hypotheses about that, whether it's diet, processed food, the rise of obesity, other endocrine disruptors that we may not know about, environmental toxins. It is definitely something that we need to be talking about. And different types of carcinogens that we may not be aware of, whether it's straightening materials for the hair or alcohol that we tend to normalize in this country, but we know is a carcinogen as well. The levels of processed foods that people eat, what's available to different populations from an economic standpoint in terms of exercise and diet is extraordinary.
Yeah. It's interesting because we've been having a lot of conversations about women's health recently, especially, thankfully, due to the whole new focus on women's health, which actually was jump-started again by the White House initiative, focusing on investing in women's health. Now, all that said, and we all know that there's lots of areas of women's health that have been ignored and continue to be ignored, but one might argue that breast cancer actually is one of
Yes.
the best studied.
Yes. Yes.
So what's wrong with this picture and what's missing?
I think it's more what can we learn from it.
Yeah.
So when I first came out with wanting to do this and the platform that we could do better by women, there were some of my mentors that said, well, wait a minute, hold up, we are doing really well in the breast cancer space. That is an area that we should be championing, that we have not only extended the lives of women, cured more women, but improved their quality of life. So I think, that's lots of different ways that we can think about it. One, there was a societal turn where you had more women open about their diagnosis. You had improved imaging techniques. You had tremendous philanthropy. I used to be most recently at Memorial Sloan Kettering, where there was a tremendous partnership between a truly iconic figure in breast cancer, Larry Norton, and Evelyn Lauder, that also contributed to financial input and philanthropy into the breast cancer space, which dramatically changed the landscape of the type of treatment that we offer patients. For example, Breast Cancer Research Foundation raises over $56 million every year, funds almost, I think, 260 scientists around the world who have been part of every major advance of breast cancer.
Yeah.
It's extraordinary. So the more that we engage the population to invest in women's health, it's a tremendous example of across the board, from preclinical to actual clinically meaningful treatments for patients, how when you invest in patients, when you invest in women, you can improve the outcomes of women.
Yeah, I mean, I want to come back to the title of your book. It's All in Her Head, right? This is something that we've all heard, through the ages, right? And so if a woman is having a bad day at work because, there was some conflict going on at work, there's always a reference to, oh, she's PMSing, she's being very irritable today, all the way to, whether it's breastfeeding, whether it's, having, menopausal issues, perimenopausal issues. These are things that, are very special to the women's body. So we have a whole host of things that are women's health that people typically put in the women's health bucket. But then there's things like heart attacks, things that are common to men and women. There too, women have very special, different, set of circumstances compared to men, for example, with heart attacks. But when women show up at the hospital with potentially a heart attack, they're taken less seriously. So how do we solve for all of this, and how do we kind of take out this whole syndrome about it's all in her head?
I want to pick up on a couple things that you said. First being about the hormonal issue. It's almost like you're damned if you do and damned if you don't. If you're menstruating, you're hormonal, you're unreliable. If you're postmenopausal, you're too old, right? So we neither care about the woman from puberty to childbearing years, and then in a postmenopausal setting, we somehow have forgotten about the aging woman and the aging brain and all the conditions that can go along with that, whether it's osteoporosis, increased rates of heart disease, as you talked about, Alzheimer's disease, cognitive function. So you can see at every part, it's when is the ideal time for us to be powerful?
Yes.
There's no place for it, right?
Yeah.
And then, yes, of course, when you talk about things like heart disease, the fact that it's the number one killer of women, yet so many of the interventions have been studied on men and then presumed to be translatable to women. Our vessels look different. The imaging techniques that we need, the type of diagnostic procedures and surgeries may look different for us. The medications, the way that we metabolize them may be different. The way that we present with arrhythmias and heart disease, again, heart attacks can be dramatically different. So I think, how do we fix that is a huge question. It starts understanding the types of questions that we need to ask. We talked about curiosity in the very beginning, how science evolves, making sure that we are listening to women before we formulate the questions we think we need to be asking, making sure there are enough women at the table who are conducting that work, asking those questions, funding that research that's so important, and then all the way through the treatments that we provide, and then how we offer them in the clinical setting. We can have the best treatments in the world and prove them in a clinical trial, but if they're not translatable in that one-on-one doctor-patient relationship or in that emergency room, then we have not fully actualized our potential with medicine.
And one of the things we all know about, the medical field in general is, regardless of age, gender, background or what have you, you have to exert your voice. Meaning you have to advocate for yourself. Because a lot of times physicians may or may not always be up to speed with the latest, technologies. How do women find their voice, number one, and stand up and advocate for themselves?
I think it's a lot of pressure. I'm still trying to figure it out myself, right? And at the end of the book, in the conclusion, with all of my resources and academic knowledge and everybody I know is a doctor. I still, when it came to my own health, had a very hard time advocating for myself when I was in pain and being in a setting where I felt very vulnerable. So I don't have all the answers, but I think it takes a village, and I think it takes a community. And I think when you're sick or when you're anxious or when you're in pain, to always put the burden on the patient to have to do that is incredibly hard. And I can say that from personal experience. So that to the extent that we can create a more empathic environment so that women can have that chance, I think it's so important. If you have a new diagnosis with something, if you're worried about it, being able to bring somebody with you who can be by your side and say, you know what, I got you. I don't care if you're worth $1 billion or you're, this massive, incredible litigator. It doesn't matter. Everybody needs someone by their side.
Yep. And, at the end of the day, you're not trying to fix the woman or the patient. You want to fix the system.
Yeah.
Right?
Yeah.
So, at Cure, we consider ourselves an empowerer, a destination for startups and entrepreneurs who are trying to bring breakthroughs that they've discovered all the way to the market and to patients. So what advice do you have for entrepreneurs, especially women or any entrepreneur focusing on women's health issues?
Well, the first thing I'll say, quite humbly, is I know what I know and I know what I don't know. I don't have a startup, and I'm not an entrepreneur. I don't know that I'd be very good at it.
Yeah.
But I think if to be successful from a women's health standpoint requires the humility to know what we don't know, to invite as many different people who are part of the ecosystem of our healthcare to really figure out where are we coming from. In the medical setting, in the research setting, sometimes what I see all the time, and in certain laboratory collaborators, you can have the best scientists in the world. So there was a project that I was working on and continue to work on with respect to mammograms and liquid biopsies and trying to refine the type of imaging that we do and pick up microscopic disease. And I was working with a brilliant scientist in a laboratory who just didn't understand why it was hard to consent women for for a blood test after they had an abnormal mammogram. Well, okay, it's just like an x-ray, right? And most of the time it's going to be fine. Why don't they just want to go get a quick blood test? Okay, they could be afraid of needles. They just had a scary exam. They just had their breast compressed. They may be in pain. They may be terrified that they have cancer. The idea that this scientist had no idea what it was like to get a mammogram and what it could feel like. And he could be the smartest person in the world and doing things I have no clue how to do, right? But unless we're talking together, unless we're really thinking about it. And sometimes I have seen with some startups that there is a linear focus on what they think they know without really engaging in a broader swath of what it means to be successful and if your mission is to improve the lives of women, then you have to understand all the ways that women interact with our healthcare system.
That's great advice for entrepreneurs. Now, before we end this conversation, I wanted to ask you, what does the word cure mean to you?
Well, what an existential, interesting question, especially from my vantage point. None of us live for forever. We are not cured of everything. We are all suffering from something. Even in the setting of cancer, when we cure somebody of their disease, they may be suffering from the anxiety that it could come back. So I think to cure as an oncologist means to me to be present for suffering, to ease suffering, to not abandon people no matter what they are going through, because we will never have some sort of almighty power to have us live for forever. But I think we can make the world more compassionate, we can cause less harm, and we can ease suffering. And that's certainly what I hope to do in my job.
Do you think that having more women in science, more women in the medical discipline, more women leaders, more women founders will actually have a role in better women's health?
I certainly hope so. I mean, we know that our medical system and scientific world was not built with women. We were excluded from medical school, and obviously now we have greater than 50% of medical school graduates being women. My concern with resting there is to say that it is not just about the number of women, but it's more about the diversity of spirit and more thinking about what we classically refer to as male energy versus feminine energy. You can have male physicians be extraordinarily empathic and listen well. And if we have these assumptions that men can't do this and only women can, and and we volunteer better and do conflict resolution better. This is all ridiculous. We can all do these things equally.
Yep.
So yes, I think we need to make sure that women have a presence, but it's also a presence that's valued. So the things that we traditionally think of as feminine, value those as well, as much as we value those other qualities.
Well, thank you, Elizabeth. Thank you for joining us here at Cure and for the great conversation about women's health.
Thanks for having me.
And for more information about Dr. Komen and her book, read our story on the website, wewillcure.com. Thank you for joining us. See you again next week.